Hi, my name is Shah. I'm the Director of Breast Radiation Oncology and the Director of Clinical Research at the Cleveland Clinic. With the identification of the HER2 biomarker, as well as targeted HER2 therapies, an important question facing patients and their treatments is, what is the role of HER2 therapy with respect to radiation therapy? Over the past decade, we've seen an emergence of HER2 agents beyond the original Herceptin or trastuzumab, with HER2 therapies used as neoadjuvant therapy and also given after chemotherapy has been given in the setting of residual disease at the time of surgery. An important question is, how does this impact the role of radiation? In women with early stage breast cancers, we have good data to suggest that when women are HER2 positive and get HER2 directed therapy, that their recurrence rates actually approximate low risk breast cancers. Dr. Bellin and her colleagues published the APT trial, which was published in the Journal of Clinical Oncology, and showed that when HER2 directed therapies were given to patients, their local recurrence rates approximated those of luminal A or favorable risk breast cancers. As such, women with early stage breast cancer can receive the same types of treatment in terms of radiation as patients who are HER2 negative and otherwise favorable. So for example, a patient with early stage breast cancer is HER2 positive who would otherwise be eligible for partial breast irradiation remains eligible for partial breast irradiation if she receives HER2 directed therapy. With respect to locally advanced breast cancers and those requiring lymph node radiation, it's less clear based on prospective data whether HER2 therapy changes the role of radiation. As such, current radiation therapy recommendations are primarily based on the clinical and pathologic staging rather than HER2 status and the role of HER2 therapy that's received. So for example, a patient with a T2N1 breast cancer that's HER2 positive may still be recommended to receive radiation to the lymph nodes, whereas in some settings, a HER2 negative ER positive patient may not be recommended to receive radiation or may even receive an oncotype test to help determine the role of radiation. However, it's expected in the years to come that this area is further clarified with subsequent prospective studies.